Coronavirus cases are continuing to climb across the U.S. Nearly 50 million COVID-19 infections have been reported since the start of the pandemic. More than 790,000 people have died, with nearly 33,000 deaths added in the past month alone. Public health experts say the Delta variant is still causing a majority of cases. But as Delta dominates a wave of new infections, the Omicron strain has now been detected in at least 20 states. And scientists have new data on Omicron. Nikki Battiste reports.
Tonight, the CBS News Bureau in South Africa has learned the Pfizer vaccine may only offer a partial shield against the new Omicron variant. An early study by the South African scientists who first detected the variant shows Omicron's ability to evade the Pfizer vaccine is robust, but not complete, and that a booster shot could help stop infection. Today, Dr. Anthony Fauci said based on preliminary data, Omicron appears to be highly contagious and have a much higher probability of reinfection. Symptoms reported so far don't seem severe, but he stressed it's too early to draw any conclusions. But news of the new variant seems to have boosted the vaccine effort in the U.S., with the most people, 12.5 million, getting a shot since May. And as COVID cases are rising in 33 states and hospitalizations are increasing in 25, many are wondering whether or not to cancel holiday gatherings.
In the face of Omicron, what's your advice to us? What should we do?
So I'm weighing these same questions as everyone else. What I'm telling people for now is make sure you're vaccinated, make sure you're boosted if you're eligible, and consider using rapid tests before in-person get-togethers to help decrease the risk of infection.
In the face of Omicron, public health officials continue to stress the importance of getting vaccinated. Tonight, nearly 25% of Americans have yet to get a first dose.
What keeps me up at night around COVID is the number of people who have not yet gotten their vaccine. It is absolutely our best way out of this pandemic.
Scientists here in the U.S. are also studying vaccine effectiveness against Omicron. Dr. Fauci says we could have those results in about a week. Elaine?
Nikki Battiste, thank you. For more, let's bring in Dr. Ali Raja. He's an ER physician at Massachusetts General Hospital and a professor at Harvard Medical School. Doctor, thanks very much for being with us. So early studies of the Omicron variant suggest the highly mutated strain may be producing less severe infections than previous variants like Delta. Is that the general perception among scientists, or is it still early to conclude anything?
It's such a good question, Elaine. A lot of the data is coming from countries where Omicron was first detected, like South Africa. Their populations skew a little bit younger than the rest of the world. For example, we don't know whether or not the milder cases they're seeing there will apply here in the U.S., where we've got many older patients as well. So it's definitely still too early to know whether or not the symptoms will be more severe, despite the fact that I think we all feel pretty confident that it is going to be more contagious.
Well, Omicron has been reported in at least 20 states. What questions have you been getting from your patients about this variant?
Oh, my goodness, Elaine. I have to tell you, this is the topic of conversation for every single patient I see, whether they're there with a heart attack or concerns for a heart attack, or whether or not they're coming in with a sprained ankle. Somewhere in the conversation, Omicron seems to come up, and they're all wondering the same thing. Here in Massachusetts, we have a full vaccination rate of about 85, 86%. And people are wondering whether or not they need to get a booster. My answer is that yes, you do. Not only will it likely protect you against Omicron, and this new data coming out that you just discussed earlier does seem to support that, but it will also prevent Delta, which is predominantly the strain that we're seeing right now.
Right. In fact, cases of COVID-19 are going up in the U.S., mainly fueled by the Delta variant. What are you seeing on the front lines, and how should we prepare for the holidays?
Well, Elaine, like Dr. Randy just mentioned, this is something that all of us are wondering about. A lot of us are talking to our patients about, but also personally that a lot of us are talking to our families about. And I think the advice that she gave is spot on, that we need to do everything we can to be safe and careful, but that for now, there isn't a reason to start canceling your holiday gatherings if you're doing so safely, meaning that you have gotten vaccinated, you've gotten the booster if you're eligible, and you've had the right time frame, that you're doing rapid tests before meetings. And for unvaccinated people, you're wearing masks indoors. All of that makes sense, and I think we can still do the holidays pretty safely.
On the treatment side, the FDA is expected to soon authorize prescription pills by Merck and Pfizer to treat COVID-19. What kind of role could this treatment play in the fight against this virus?
These are going to be game-changing. Now, you have to remember that right now, all of our hospitals are full. Every single hospital's emergency department is full. The inpatient units are full. Some of the patients are there with COVID, but predominantly, we're hitting a really busy time in terms of patients needing medical care. The amazing thing about these treatments by Pfizer and Merck is they allow for in-home treatment. You get a positive test, you still feel pretty well. In 5 days, you can have that treatment, and it'll reduce the risk of hospitalization by up to 85%. We can treat patients at home, which we haven't been able to do thus far.
Well, according to research published in the peer-reviewed journal MBio, coronavirus infection plus vaccination could give better protection against COVID-19 variants. Why might this be?
I read that study, Elaine, and it's really interesting. It turns out that if we look at the virus, it has these little spike proteins, and the spike proteins change over time from the original variant on to the beta or the gamma variant over time, all the way to Omicron. But the body's reaction in terms of antibodies is supplemented each time that it's exposed. So repeated exposure to the spike protein. For example, somebody who was infected last year before the vaccines were available and then got vaccinated, so was exposed multiple times, maybe even again with the second dose and a third time with the booster, not only do they produce a lot of antibodies, but they produce better antibodies against the spike protein. And so it seems like repeated exposures might make better antibodies, which will really impact how we develop vaccines, but also how we develop boosters in the future.
All right, Dr. Ali Raja, thanks so much for sharing your expertise with us.
Thanks, Elaine.